Hey, I'm Zanzi, and welcome to Farmers Inside Track, episode 155. I'm your host, Donumdu. Now, over the past few weeks here on Farmers Inside Track, we've touched on animal health care in our One Health campaign with Vuyokazi Makapela, a director at Afrivet. She's back and talking to us now about the South African Rabies Advisory Group. Vuyokazi, tell us about the South African Rabies Advisory Group. What does it aim to do?
Hi, Don, and thanks for having me. RAG, which is your Rabies Advisory Group, their aim or main focus is to ensure that South Africa is successful in the global drive to eliminate human deaths due to canine rabies by 2030. This group comprises of representatives from the animal and human health sector, as well as the environmental sector, and that forms the One Health team, representing government, private, and the academic sector. This team develops and supports the National Rabies Strategy and advises in complicated rabies cases and outbreaks.
Now, the main focus of RAG is to ensure that South Africa is successful in the global drive to eliminate human deaths due to canine rabies by 2030. Tell us about RAG's approach to accomplishing this.
The approach really is to ensure that all dogs and cats are vaccinated and that people that were exposed to the rabies virus receive the correct post-exposure treatment. There is a national rabies strategy that exists, but the main focus is to ensure that all dogs and cats are vaccinated against rabies. It is the law in South Africa. The advisory group has really worked hard over the years in making sure that they raise awareness of rabies to government agencies, medical and veterinary professionals, as well as the communities. They aim to really improve pre- and post-exposure measures for humans and the control of rabies in the animal population, as well as the country. People, therefore, must receive the correct post-exposure treatment after exposure to rabies virus. That is, whether they've been bitten, they have a leak, or have been scratched by a suspected positive animal.
Now, there are a number of steps to follow once a rabies outbreak is detected. Could you list those steps for us, please?
There are quite a number of steps to be followed when the rabies outbreak is detected, and it's basically the protocol that needs to be followed immediately once the rabies outbreak is announced. People need to keep track of where the suspect animal is and inform the nearest state vet office. They need to contact their medical doctor immediately once they've been exposed, and this would be in a form of a leak, scratch, or even a bite. Whilst waiting for medical assistance, they need to wash the wound with soap and water for at least 15 minutes, because this actually dilutes the amount of virus in the wound. The suspected rabid animal will then be sent for euthanizing if it is not vaccinated, and it will later be tested for rabies. If it is vaccinated, it will be quarantined for 10 days to assess its symptoms, and if it dies within those 10 days, then it will be tested for rabies. The exposed person must immediately receive post-exposure prophylactic treatment, which is your PEP. One should never wait for the dog test results to come back to seek PEP, because this PEP or post-exposure treatment needs to start from day 0 of the exposure and as soon as possible after that. This might seem minor, but it is a major issue in practice, as it's the difference between life and death, especially if the person was actually exposed on the face. The correct and complete post-exposure treatment protocol is the only way to prevent death as a result of rabies. Once a person starts to show symptoms, there is nothing else that can be done. This is heartbreaking because rabies is really preventable. And lastly, the incubation period, which is the time between exposure to the virus and showing rabies symptoms, can be anything from 2 weeks to several months or even years. This actually depends on where the virus has entered the body. For example, it actually takes longer for the virus to travel via the nerves to the brain of the patient from a wound on the foot versus a patient that was bitten on the face. This is why immediate and correct PEP treatment is so important. Once the virus has entered the nervous system, there is not much that can be done for the patient.
And then before we let you go, what are some of the most important aspects to understand when it comes to rabies?
The most important aspects to understand when it comes to rabies, the fact that animals and humans alike can be infected by rabies. Rabies is 100% fatal, as much as it's 100% preventable. The state vaccination campaigns provide vaccines for free, and this means it's at no cost to the owners. Rabies isn't limited to occurrence in rural areas, but also in urban areas. Anti-vaccination campaigns in humans should not affect vaccinations for pets. State vet services are involved in the diagnosis of a rabid animal, and the officials must be called immediately after exposure so they can collect the animal in question and have it tested. The only way you can test for rabies is by collecting and submitting an animal's brain, which means it would need to be euthanized first. Sadly, most rabies fatalities occur in children, as children are more inclined to touch animals than adults are because they play as children. Unfortunately, because a lick, a scratch, or even a bite doesn't always present as serious in the eyes of the parent, they might not seek medical attention immediately until the child presents symptoms, and then it is already too late. Adults must therefore take it upon themselves to educate their children about rabies and responsible pet ownership in order to save their lives. Maybe just lastly, we all need to make sure that our cats and dogs are vaccinated against rabies. And I cannot stress this enough. It is actually the best and most cost-effective way of protecting yourself, your family, and your community at large against this disease. So people must just make sure that they report suspect cases and seek medical attention immediately if they were exposed to a rabid animal. It will save lives.
Thank you so much for joining us here on Farmers Inside Track once again. Vuyokazi Makapela. She's a director at Afrivet. Remember, if you love this podcast, please rate it and share it with your friends, family members, and fellow farmers. From me, Dawn Numdu, our producer Megan van der Vent, and the rest of the Food from Zanzi team, have a great week. Bye for now.
Life in South Africa can be a lot. I mean, scroll through Twitter for a minute and tell me I'm wrong. Thank God for South Africans though, right? We're inspiring, and even on the bad days, we fight back with a smile. That's why I love Food from Zanzi so much. They're not ashamed to celebrate the ordinary unsung heroes who work every day to put food on our nation's tables. Go to foodfromzanzi.co.za and never miss an inspiring story.